Hello, my name is Tammara Harbaugh, and this is a teaching video how to give a dental injection using the field block technique, also known as infiltration. The armamentarium needed to give a dental injection is an aspirating syringe, a 27 to 30 gauge short needle, 1 cartridge of anesthetic, sterile woven gauze squares, and topical anesthetic. The syringe can be prepared ahead of time. Place the cartridge into the syringe first. Advance the syringe so the point engages the plunger, and then attach the needle to the syringe. The reason for doing this is that if you put the cartridge in and hit the end of the syringe, the glass could break and cause injury. So you want to do that before you put the needle on. The patient's health information has been reviewed and the patient's vital signs has been taken, and it has been determined that she is a good candidate to receive a dental anesthetic injection. In preparing her for the injection, she needs to be fully reclined. Her head should be at the height of the operator's elbows, and the operator should be seated at a 10 o'clock position in order to have a full visual field of the area being anesthetized. When preparing to give the dental injection, the first step is to use a sterile gauze and wipe the area that the injection is going to be given. The reason for this is this removes any bacteria and debris that could cause a post-injection infection. Now place the topical that is on a cotton swab on the injection site and allow the topical to remain on the area for 1 full minute. This is a very important step. If you follow the manufacturer's directions, which is 10 to 15 seconds, that has the same effect as a placebo, as documented by Dr. Stanley Malamed in the Handbook of Dental Anesthesia. The reason why infiltration anesthetic works well on the maxilla is because the bone is cancellous and spongy, and it allows the solution to penetrate the bone and reach the nerve to produce profound anesthesia needed for a dental operation. Okay. The topical has been in place for over a minute, so I'm going to remove the topical swab, and now I'm going to use a gauze square to retract the lip to fully expose the vestibule area. It is important that the needle bevel be oriented towards the bone. Keep the syringe oriented towards the long axis of the tooth. Insert the needle about 1 to 2 millimeters or until it reaches the apices of the tooth. Aspirate a quarter turn, aspirate again. If the aspiration is negative, advance the plunger and deposit 0.6 milliliters of anesthetic over a 20-second period. It must be administered slow. Once the appropriate amount of anesthetic is given, slowly withdraw the needle. After the dental injection is complete, recap the needle either using a mechanical device or a one-handed scoop method. That way, the needle can be safely disposed of at the earliest convenient time in a sharps container. After the dental injection is complete, the operator should wait a full 2 to 3 minutes before considering starting the dental procedure. And it's important to even ask the patient if they feel like they're getting numb.
Yes, I am.
You are getting numb?
Yes.
What are you feeling?
I'm feeling numbness in my lip, and even up until my nose is a little numb.
Okay. So I think that now we are ready to go ahead with our dental procedure.